I'd like to talk a little bit about patient safety and WHO, okay? I've introduced you to WHO. Now you are all experts a little bit in how WHO is working. And I've talked a little bit about important concepts in patient safety, okay? Especially the whole idea that patient safety is about systems, okay? I'd like to talk for the next few minutes about what WHO is doing in the area of patient safety, and we're really leading in the following 4 areas, okay? In convening global leadership and developing policies and strategies around patient safety. In promoting collaboration and partnership, okay? In developing standards, guidelines, and tools, and in the measurement of trends and progress. I should indicate that for any health issue, whether it's infectious diseases, whether it's it's patient safety, whether it's health systems, these are some of the core functions of WHO, okay? Leadership, policy development, convening collaborations and partnerships, and developing and supporting countries to develop technical norms and standards and adapt them to their concepts. So in the area of leadership, policy, and partnerships, WHO is about leadership. It's about developing policies and partnerships. We provide global leadership and strategic directions on matters critical to safety and quality of health services, okay? We actually have a special envoy for patient safety. His name is Sir Liam Donaldson, and he has said basically that, and I quote, "To make an error is human, to cover the error up is unforgivable, but to fail to learn from your error is inexcusable," okay? This underscores the notion that patient safety and patient care must be a learning process, okay? It is a process that involves continuous introspection and learning. We are involved at both global and regional levels. So our global headquarters and our regional office, which is located in Delhi, the Sierra Regional Office, is involved in promoting issues around patient safety. And we work to strengthen collaboration internationally and within WHO. We have led on initiatives like the Global Patient Safety Challenge, which I'll talk about in just a minute, and on other global advocacy campaigns. So one of WHO's roles is to put patient safety and quality of care on the global agenda, okay? It's really to get the highest level commitment sort of toward the whole concept of patient safety and quality care. And it does this through, one of the ways it does this, that the WHO does this, is through the World Health Assembly, which I mentioned previously as one of the core institutions or pillars of the WHO. Again, this is the meeting, the assembly of all of the ministers, health ministers of the world, that occurs every May in Geneva. This is an example. This is a picture from the World Health Assembly. And an example is World Health Resolution 55.18, which is about quality care and patient safety, which passed in 2002. It was really the first resolution of its kind on patient safety that all the countries of the world agreed with. And the gist of this resolution was to request WHO to support the efforts of member states to promote a culture of safety and quality within their healthcare organizations, okay? So what the member states, the countries of the world, asked WHO to do was through the development of policies, the development of guidelines, the collection of basic health data and information to support countries to promote a culture of safety and quality care within healthcare organizations. So this is, at WHO, we pass a lot of resolutions. We have a lot of documents. And these are all of the different types of resolutions and declarations on patient safety that have passed since 2002, okay? Some of them have passed at the World Health Assembly, okay? So I mentioned the resolution on quality of care, patient safety in 2002. And then so I think that's There was, at the World Health Assembly in 2004, there was the launch of the World Alliance for Patient Safety. There have also been a number of resolutions which are available on our websites and which I can provide for you, passed by the Sierra Regional Committees. So so we have a global World Health Assembly, and then we have what's called the Regional Committee, where the 11 member states of the Southeast Asia region meet every year, generally in September, and they also pass resolutions for the 11 countries, applicable to the 11 countries within the region. So 2 of those resolutions in 2006 and 2007 are about promoting safety, patient safety in healthcare, and of course the Jakarta Declaration on Patients for Patient Safety in the Sierra countries, in the Southeast Asia regional countries. And most recently, in 2015, a resolution on patient safety contributing to sustainable universal health coverage. So one of the programs that WHO has that I think is very interesting and that I think is worth mentioning is the WHO Global Patient Safety Challenge. Has anybody heard of this? You guys need to go to our website a little bit, I think, because this is actually very interesting, and it's basically a core program of what was called the World Alliance for Patient Safety and is now integrated into the Department of Safe Delivery and Safety at WHO. It's essentially a program of change aimed at improvement and risk reduction. And it's actually a series of challenges, and each challenge covers a topic that addresses a major and significant aspect of risk relevant to every country, okay? It blends evidence-based interventions with implementation strategies, and it seeks to achieve widespread engagement and commitment. So,
Oops, sorry. I already.
Did I get, oh yes, I nodded on, right, okay. Okay, so the first challenge was called Clean Care is Safer Care, addressing hand hygiene as a means to prevent the spread of healthcare-associated infections. This was a challenge that really showed people sort of established standards for hand washing, for instance, and sort of cleaner hand hygiene was one of the most critical elements in healthcare contexts. And it really also addressed the whole issue of nosocomial infection, which, for which hand hygiene is absolutely so critical. The second global patient safety challenge was called Safe Surgery Saves Lives. Okay? This challenge focused on improving the safety of surgical care in order to prevent errors, avoid injury, and save lives. Okay? So this came out shortly after the first one on hand care. So these global patient safety challenges have galvanized global commitment on important aspects of patient safety. Okay? They've widely promoted the concepts of patient safety more generally, and they promoted novel approaches, especially around behavior change and the introduction of surgery checklists. I remember when I was working in Ghana, there was no such thing as any sort of surgery checklist. And so people would forget sponges in the patient's body, or they would, forget to look at the x-ray and they take out the right lung and not the left lung. And so we established these patient checklists, and they were actually very, 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 very useful. The third Global Patient Safety Challenge is planned for launch in this year, in 2017. And it's really addressing the whole concept of medication safety, to address unsafe medication practices and to improve medication safety across the world. So this represents the third global challenge for patient safety. So you can see that each one of these has addressed the major causes of adverse events in the clinical care context that I mentioned at the beginning of my presentation. The first global challenge addressed the concept of hand washing and in order to address the problem of nosocomial infections. The second was about improving the quality and the safety of surgical procedures. And the third, this one, will be about medication. So these are addressing the really critical problems and critical challenges that we have in the whole area of patient safety. So I've talked about leadership, and I've talked about some of the policies, and I've talked about the global challenge. WHO is committed to creating global partnerships for strengthening collaborations internationally. And WHO has a number of centers called collaborating centers. In Thailand, we have 34 collaborating centers in various specialty areas. I don't believe we have a collaborating center for patient safety, but certainly WHO has collaborating centers, universities, et cetera, that we work with. They have the clinical center for clinical risk management and patient safety in Florence. We have the network of hospitals in Geneva, Switzerland, and we have the National Arbitration Commission in Mexico. So we have a global network of collaborating centers that support us in the whole area of patient safety. In addition, as part of its convening role, WHO has organized a global consultation on setting priorities for global patient safety in late September of last year. I've actually met some of you already this morning who attended this consultation. The aim of the consultation was to cultivate a global expert think tank to identify key challenges, new directions, and hot topics for priority action in global safety over the next 5 to 10 years. About 140 participants from 30 countries attended this consultation. And really the event was hailed as a landmark for patient safety, advancing global thinking, informing leaders, setting standards, and helping set a new strategic direction for WHO and its global partners. There is also a WHO Global Patient Safety Network. This is an online platform for key stakeholders to share and discuss ideas, approaches, tools, and best practices from around the world. There are over 60 countries who participate in this platform and 400 members. Okay? So this is a wonderful opportunity for people in the field to discuss issues that they have, bring up solutions, bring up ideas, bring up challenges. Like I say, this network aims to stimulate dialogue, promote continuous learning, and create unique opportunities for contributing to improving patient safety globally. It's especially important for low and middle income countries. So I've talked a little bit about WHO global leadership, and I've talked about our role in convening partnerships. I talked about the meeting in Florence. I talked about the online platform that WHO has. We also have a role in promoting technical best practices, okay? This is a technical series on safer primary care. It consists of 9 monographs. These are available on the WHO website, which I'll give you at the end in case anybody's interested. They explore the magnitude and nature of harm in the primary care setting and provide practical solutions and practical next steps for improving safety. I think these primers would be very useful. If you're not familiar with them, would be very useful for you in your different clinical contexts. The primers really mean to raise awareness among member states about causes and consequences of unsafe care, provide interesting and accessible summaries about key issues, and help increase our knowledge about how to design and deliver safer primary health care. And of course, capacity building is very critical. We support education and training of the workforce. We build the capacity for patient safety among healthcare professionals. We've developed a multi-professional patient safety curriculum guide to strengthen academic capacity. And we've also provided comprehensive patient safety training for healthcare educators, leaders, trainers of trainers. So we're very, very much involved in building capacity, both from our headquarters level and from our regional level. And finally, we help member states collect information. We help them monitor the health situation and assess trends. Metrics for patient safety. There are core 100 indicators for patient safety and quality. And these are also available to you on our website. So I wanted to talk very briefly about the Sustainable Development Goals. Everybody knows about the Sustainable Development Goals? Okay, these are really important because this is going to be the focus the Sustainable Development Goals are really going to be the focus of global development in the next 10 to 15 years. There are 17 Sustainable Development Goals. These Sustainable Development Goals replace the former Millennium Development Goals, which many of you heard about, okay? So where there were 6, I believe 6 or 8, I can't remember, Millennium Development Goals before, there are now 17 Sustainable Development Goals, okay? Goal 3 is about health, okay? It's about good health. But health is involved in many of the other development goals. Health is linked to many of the other development goals. So the Sustainable Development Goals are different from the Millennium Development Goals. They're very, very ambitious, okay? Before we had under 10, now we have 17, okay? They reflect real life. They reflect the real life problems that challenge us globally. There's a strong focus on equity. One of the bylines of the Sustainable Development Goals is leave nobody behind, okay? So everybody must benefit from the Sustainable Development Goals. The goals are interlinked. It will not be possible to achieve one goal without working on or achieving another goal. We're not starting from zero. There's already been a lot done, and I'm going to talk about that in just a second. But we do need to work across sectors, okay, to achieve the Sustainable Development Goals. This will be very, very critical. So you can see from this graph that this is progress on trends in maternal mortality in the Southeast Asia regional country, in the Southeast Asia countries, the countries of the Southeast Asia Regional Office of the WHO. And I think that what this slide shows is that there was in many parts of the world, in Southeast Asia, significant progress on the Millennium Development Goals. Okay, so these are trends in maternal mortality, and you can see across the region that maternal mortality went down since 1990, and really many of the countries in the Southeast Asia region achieved their goals, Millennium Development Goals, in relation to health. Okay, so this is SDG 3. This is now the next generation. The goal is actually stated to ensure that healthy lives and promote well-being for all ages. So each of the 17 goals has a series of targets, okay? There are 9 targets for this health MDG. Some of the targets are what we call the unfinished agenda. So for countries that have not yet reduced the burden of child mortality, that have not yet reduced the burden of mortality, of maternal mortality, those MDGs that are not finished are now continued as targets within the health Sustainable Development Goals, okay? So it's not like we're forgetting the previous agenda and we're moving on now to something new. We're continuing with our work in the previous agenda. There are some new targets for SDG 3 that were not in the previous MDGs, and one of the most obvious to me is non-communicable diseases. Okay, nobody in the MDGs talked about NCDs, and yet non-communicable diseases, as you know, are a huge problem in developed countries and even in developing countries and in middle-income countries like Thailand. Okay, so there are a whole series of targets, and that's the box in the middle, on sort of some of the new challenges we have in the health sector. Target 3.8, I think, is really the most important one, okay? And it's all about assuring universal health coverage, okay? It's about achieving universal health coverage, including financial risk protection, access to quality essential health services, medicines, and vaccine for all, okay? And I've put target 3.8 up there because that is really where patient safety sits, okay? It really is all about access to quality essential healthcare services, okay? So for all of you out there who are working in the area of patient safety, it's important for you to know that what you are working on is on the global development agenda, okay? It's firmly entrenched in the new Sustainable Development Goals, and you and I and our leaders will all be held accountable for progress made in this area going forward. I don't know where my last slide is. Oh, I had a last slide that I summarized a whole bunch of things, but anyway, I just I wanted to tell you that
This is
as I was preparing this presentation yesterday, I called up my headquarters and I said, what are sort of the the five or the three or four main messages that you want me to leave with the audience that I'll be talking to. And basically, they really wanted me to leave you with sort of five things. And I think that the first thing, and I've touched on this during the presentation, is that when it comes to patient safety, enabling environments are key. Improvements in patient safety can be made with innovative, locally adaptive solutions, even in low and middle income countries. However, I wonder if I've got them here. No, I don't. However, it's really essential to create an enabling environment. If you're going to change the system, you have to create an enabling environment in order to make that change. The second is about prioritization. Patient safety has to be prioritized by you. It has to be prioritized by your hospital administrators. It has to be prioritized by ministries of health. It has to be prioritized by governments. It has to be prioritized by different sectors, and that's, again, part of the SDGs, the different sectors working together. The third is about organizational leadership. Governance accountability are absolutely essential to apply the patient safety strategies that we know work at all levels of care, from primary care right through to tertiary care. Fourthly, we need compassionate and competent leaders and a compassionate and competent health workforce. This needs to be created through effective education, training, and skill development. And finally, something I haven't talked very much about is the real role of patients in healthcare. This should be enhanced at all levels of the healthcare policy development, decision-making, health literacy. Patients' involvement in their own healthcare is a critical element of improving patient safety. So I think I've talked for a long time. I'm very happy to answer any questions you have as best I can. I should just again say that this is the WHO website. There is a whole webpage dedicated to patient safety. Many of the details of some of the global resolutions and some of the global initiatives can be found there. And you're welcome to discuss them with anybody in our office. If you have any questions about them, we'd be very happy to meet you in our office if you'd like. And I really want to thank you very much for your attention.
Thank you very much, Dr. Daniel, for your very elaborate, the presentation. And you have already briefed the audience what the WHO is, not only the Secretariat, but also the member state, and what is the Constitution, as well as what are the roles of the WHO with regard to the patient safety